Sepsis is a severe medical condition that occurs when the body's response to an infection causes inflammation throughout the body. It can lead to organ dysfunction or failure, and if not treated promptly, can be life-threatening. Sepsis is typically caused by an infection, which can be bacteria, viral, fungal, or parasitic. These infections can originate from various sources in the body. Some common causes and sources of infections that can lead to sepsis include bacterial or viral pneumonia, especially in vulnerable populations such as the elderly or those with weakened immune systems. Also, urinary tract infections caused by bacteria, particularly if they spread to the bloodstream, can result in sepsis. Infections in the abdomen, such as appendicitis, peritonitis, or infections of the gallbladder and liver, can lead to sepsis. Serious skin infections like cellulitis or infected wounds can progress to sepsis, especially if bacteria enter the bloodstream. Other infections associated with medical devices like urinary catheters, intravenous lines, or surgical wounds can also introduce pathogens into the body, potentially leading to sepsis. The mechanism of sepsis involves a complex interplay between the immune system, inflammatory responses, and the body's attempt to fight off an infection. Here's a simplified overview of the key mechanisms involved in sepsis. Sepsis begins with the presence of an infection in the body, which can be caused by bacteria, viruses, fungi, or parasites. This infection triggers the immune system's response, which recognizes the presence of pathogens and activates an inflammatory response to eliminate them. In a normal immune response, inflammation is a protective mechanism to contain and eliminate the infection. However, in sepsis, the immune response becomes dysregulated and excessive, leading to systemic inflammation throughout the body. One of the key aspects of sepsis is the release of large amounts of pro-inflammatory cytokines, such as interleukins and tumor necrosis factor, and other immune signaling molecules. This cytokine storm contributes to widespread inflammation and can lead to tissue damage and organ dysfunction. The inflammatory response in sepsis affects the endothelial cells lining blood vessels, leading to endothelial dysfunction. This dysfunction contributes to increased vascular permeability, leakage of fluid into tissues, and impaired regulation of blood flow. Sepsis can also lead to disturbances in the body's normal blood clotting mechanisms, causing both excessive clotting, coagulation, and bleeding tendencies. This can further impair blood flow and contribute to organ dysfunction. The combination of systemic inflammation, endothelial dysfunction, coagulation abnormalities, and impaired blood flow can result in organ dysfunction or failure. Organs commonly affected in sepsis include the kidneys, lungs, liver, and heart. In severe cases, sepsis can progress to septic shock, characterized by dangerously low blood pressure and inadequate tissue perfusion. Sepsis symptoms can vary depending on the stage and severity of the condition. They often mimic symptoms of other illnesses, which can make sepsis challenging to diagnose. Here are the common symptoms associated with sepsis. Sepsis can cause a high fever, although in some cases, especially in older adults or individuals with weakened immune systems, there may be a low body temperature, hypothermia, instead of fever. The heart may beat faster than normal as the body tries to compensate for decreased blood pressure and maintain adequate blood flow to organs. Breathing may become faster than usual as the body tries to get more oxygen into the bloodstream to support vital organs. In some cases, sepsis can lead to respiratory distress, shortness of breath, or difficulty breathing. Sepsis can cause a drop in blood pressure, which can lead to dizziness, lightheadedness, or fainting. In severe cases, it can progress to septic shock. Sepsis can also affect brain function, leading to confusion, disorientation, or changes in consciousness. The kidneys may be affected, resulting in reduced urine production or dark-colored urine. Sepsis originating from abdominal infections can cause abdominal pain, tenderness, or discomfort. Some individuals with sepsis may experience nausea, vomiting, or other gastrointestinal symptoms. The skin may show signs of infection, such as redness, warmth, and swelling, or the presence of infected wounds and infected sores. How to investigate a case with sepsis? The investigation involves a combination of clinical assessment, laboratory tests, and imaging studies to diagnose the underlying infection, assess the severity, and monitor organ function. First, clinical assessment, which includes history taking, assess vital signs such as temperature, heart rate, blood pressure, oxygen saturation, and respiratory rate, and other clinical signs that should be noticed like decreased urine output and skin changes. Then take blood sample to evaluate complete blood count, especially white blood cell that elevated in case of infection. Lactate level, as its elevation can be helpful in initial identification of sepsis and also indicate tissue hypoperfusion. See reactive protein test as inflammatory marker. And other blood tests such as electrolytes level, kidney function, liver function, arterial blood gases, and coagulation studies to evaluate organ function and coagulation abnormalities. Look for obvious source of infection. Consider chest X-ray to assess pneumonia, CT scan or ultrasound for abdominal infection. To identify the causative organism, take blood culture. Urine culture if urinary tract infection is suspected, sputum culture for respiratory infection, and swab culture from infected wound. A case with sepsis should be managed quickly. Early intravenous antibiotics and fluids appear to be the most important. Start antibiotics as soon as possible to target and eliminate infection. The choice of antibiotics depends on the suspected pathogen and may be adjusted based on culture and sensitivity result, which should obtain before starting antibiotics if this does not delay the administration of antibiotics. Often broad-spectrum antibiotics are appropriate, like piperacillin, or ceftazidime if penicillin allergic. Begin administration of intravenous crystalloid with a dose of 10 to 20 milliliters per kilogram. And in case of low blood pressure or if lactate level is more than 4 millimole per litre, 30 milliliters per kilogram may be required. Intravenous fluid are given to restore fluid balance, improve blood pressure, and maintain organ perfusion. Provide high-flow oxygen to ensure adequate oxygenation to tissues and organs. Aim for oxygen saturation of 90 to 96%. Start vasopressors such as noradrenaline in case of septic shock and persistent hypotension, where fluid resuscitation alone is not insufficient to maintain blood pressure equal or more than 65 mm of mercury. Procedures may be performed to drain or remove the source of infection if localized, such as abscess or infected surgical site. Sepsis 6 Care Bundle is a set of 6 tasks including oxygen, cultures, antibiotics, fluids, lactate measurement, and urine output monitoring to be instituted within 1 hour of arrival to the emergency department as a frontline approach.